The abdomen, the core, the dantian, the hara, however you call it, this part of our body is the most vulnerable and is in many cultures considered to be the holder of our essence and the center of our life force. When we work in this area, we must do it with respect. I want to start off by demonstrating how to undrape a female client's abdomen. And of course, I'm going to emphasize how vulnerable this area is, man or woman. So while you're doing this, please tread carefully and with the utmost respect. I've offered my client a towel, and I'm going to allow her to hold onto it while I pull the sheet down underneath the towel, keeping her draped the entire time. Once the sheet is down, exposing the abdomen, I want to tuck the sheet around her hips and make sure that the towel is tucked in underneath her axillary area and around the rib cage, and ensure that she feels safe. Obviously, the size towel is going to vary according to your client's breast size, but use caution as you do this. Maybe practice on a friend who's wearing a bathing suit, and ensure your client's safety at all times. I'm going to use a little bit of my lavender scented Snore Total Meltdown body butter, which doesn't have as much grip, so it's perfect for lighter, more fluid work like this, especially in the abdomen. And I'm going to start by doing what I learned to be called the sun and moon technique. I don't know if that's what it's really called, but that's what I learned. If you'll notice, my left hand is drawing a circle like a sun, and my right hand is lifting up and then drawing crescents like a moon. But the most important thing to remember when you're doing pretty much all abdominal work is that you want to stay in alignment with the large intestine. So whenever I'm doing directional work in this area, I'm working along the same direction that food travels in the large intestine. So at this point, I've reached across my client's body, and I'm basically doing some light myofascial work, pulling from the back towards the abdomen. And my main intention here is to allow these tissues to open and soften. So as I'm guiding the tissues towards the front of the body, I'm also using an oppositional pull with my hands so that I'm pulling the hips inferiorly down towards the feet, and I'm lifting the ribs superiorly up towards the head and neck. While I'm here, this is a great opportunity to open up the ribs and create a little more space. So as she breathes in, the ribs open up a little bit, and I can sink my fingers into the intercostals and work through a lot of the tension and adhesions that tend to live there. For me, working on the abdominal area also means working with the diaphragm and its attachments to the rib cage, because as the diaphragm pulls down for inhalation and then pushes up for exhalation, it defines the space of the thoracic area and the abdomen. So ensuring that this is moving well is part of ensuring abdominal health. So I'm starting by asking my client to really soften her belly and exhale, and as she does that, I'm using either a thumb or the soft pads of my fingers, and starting just lateral to the xiphoid process, I'm moving along the attachment sites just underneath the rib cage, sinking up and in just a little bit, checking in with my client's comfort the entire time that I'm doing this work, and sliding out laterally as the diaphragm contracts and relaxes with inhalation and exhalation. You can do this work either unilaterally or bilaterally, depending on your client's comfort level and your confidence with this work. But just to reiterate some precautions, do not press into the xiphoid process where the solar plexus is, and do not do any work that feels irritating or aggravating. You want this work to be relieving and relaxing. I'm going to transition again with a couple of sun and moon strokes. It's kind of like the abdominal version of effleurage. And then I'm actually going to do a little specific work into the large intestine itself. Huge disclaimer here, I'm not doing any procedures, I am not a doctor, I am merely encouraging the body to do what it's supposed to do, which is what massage therapy is all about to begin with. So as I start to work with the large intestine, it's really important to know the direction in which food travels along this final section of the digestive system. So starting with the right hip and working up the ascending colon, working across the body through the transverse colon, and then down to the left hip, down the descending colon. And that's not where the large intestine ends, but that is definitely where my work ends. So I'm just focusing on very gentle compressions, working in that direction and guiding movement and absorption and balance and homeostasis and all of those good things. This next technique I use with my pregnant clients all the time. I'm reaching around my client's belly and hooking my fingers into her paraspinals on either side of her spine. And as I pull away from the spine, I'm also lifting her low back up off the table. My fingers are creating a nice myofascial drag through the thoracolumbar aponeurosis all the way into the abdominal muscles, while at the same time lifting and creating a relief of pressure off of the low back and the sacrum. Just be careful of your body mechanics on this one. You may be relaxing your client's abdominals, but yours are in go mode. Changing up my transition stroke from a sun and moon to a cloud cover. I don't know, I just made that up. So I've obviously switched to the other side of the table, and I'm doing the same work that I did to her right side, now on her left side. I'm showing a slightly different camera angle from this one, so you can see from my high-tech ceiling cam that the drag and the lift and the separation of the hips and the ribs are all kind of happening in one fell swoop. Back to the sun and moon transition, and from this side, it is not my dominant side, and it's like patting my head and rubbing my belly. This was tricky for me to get. I want to bring the work that I'm doing with her breath full circle, so I'm finding the xiphoid process in order to stay clear from that, and then I'm bringing my hand on top of the towel and gently compressing down and inferior on the sternum. I'm doing this as she breathes in to create a counter pressure, and then as she breathes out, I'm influencing the sternum down, bringing the rib cage down away from her neck and her chin, and connecting the work I did with the ribs and the diaphragm up through the sternum. In a similar effort, but with different techniques, I'm having my client lift her hands above her head, and as she breathes in, I'm lifting up from the posterior ribs this time, and as she exhales, kind of pulling down through the hips. So all of this work is just creating space in the abdomen, in the rib cage, in the thoracic area, and throughout the torso so that her internal organs start to feel more fluid. I'm having my client leave her left arm where it is and bringing her right arm back down to her side, reaching across her body again, and as I pull from posterior to anterior, I'm having her reach that left arm across to the right side of her body, creating a nice lateral stretch as I strum across the fibers of the obliques and more intrinsically start to influence the transverse abdominis, which, if you didn't know, is the muscle that is responsible for compressing your abdominal contents. So hopefully you get what that means. I don't want to spell it out, but just repeating the fact that the intention while working with the abdominal area is really typically about bringing focus to an area that doesn't always get attention and therefore tends to hold some tension in weird ways. And we want to allow the internal structures of this region to feel like they can breathe and move and perform in the way that they're supposed to. As I'm demoing this same technique on the opposite side of my client's body, I just want to take a minute to reiterate how vulnerable this area can be. And while you're doing this work, it might be a good idea to every once in a while say something kind to your client and just honor the space that they're in right now, and maybe thank them for allowing you to be the one to work with what is essentially their essence and the home of all of their life energy. It's big stuff. I want to do one more big kind of influential movement of my client's rib cage while I'm here, and this one is a little more about awareness. So I'm really taking the rib cage right under the clavicle and right underneath the lower ribs, and I'm moving it around in different directions and asking my client to drop in and see if she can feel a little more freedom and a little more room. And I'm having her take 1 or 2 last deep breaths in and dropping all of this work down into her abdomen and into her hips. If this work is done correctly, it can be really powerful. How do you re-drape, you ask? Good question. So I'm just going to pull the sheet and the blanket back over my client, and just as you might pull a tablecloth out from underneath a set table, I'm just going to pull the towel out from underneath the blanket, and she is good to go. Good job.